Breathe South Dakota is a new program that will be starting soon at SDSU after a $1.5 million grant was awarded in August of 2022. Sharrel Pinto, who is the program director, said the program is supported by the Huron Regional Medical Center, Madison Regional Health System, Brookings Health System, and Northern Plains Health Network.
We sort of partnered together to write the proposal that helped bring in money to expand the workforce and really provide services to patients in our rural communities.
Breathe South Dakota stands for bringing resources, education, awareness, training, holistic care, and empowerment to South Dakota, and its goal is to bring respiratory care to rural communities by expanding the respiratory program at SDSU.
We will be expanding classroom spaces and lab spaces and training at Huron, Brookings, and Madison. And so we do have a really great respiratory care curriculum that is now going to be launched in adding to those sites. And some of the things that our students are currently doing, we'll have a new group of students doing those at those sites.
Lacy Patnoe, who is the SDSU Respiratory Care Program Director, says potential students who live in rural areas couldn't leave and get training elsewhere, like Sioux Falls.
So this grant will really open up opportunities to bring the program to them. So then hopefully they'll stay in their communities and work as respiratory therapists because they're seeing vacancies in their hospitals.
Applications for the program will open in summer of 2023. Scholarship money will also be awarded, as well as increasing the number of students in the current respiratory program from 24 to 40. Another thing to mention is Breathe South Dakota is not just for respiratory care, but public health also.
Well, we offer a public health certificate here at SDSU. It's a completely online certificate, and we wrote that into the Breathe SD project as well. So within the education piece of that acronym, students that are interested can apply for the public health certificate and again get scholarship money to be able to pick up half their tuition dollars for those.
And for Brooke Sydow, the network coordinator for Breathe South Dakota, the cross-training for public health is a massive win for rural hospitals.
Being able to train them in that holistic perspective and look at, is there a community health worker that we can train and get this certificate? Is there an LPN that we can train into RT? Is there a paramedic or someone in ER that we can cross-train as well? So really looking at it that way and being able to incentivize it with those scholarship dollars is a big bonus.
While education and funding are an important combo, they say empowerment and teaching students what empowerment is in their career will help them.
There is a huge need to empower our healthcare workers that continue to feel so drained out by having to do things that they may not have been trained for, or just gaining that confidence and assurance that they have a support system, either from the team or the health system.
So we're going to remove that financial barrier with some scholarships and incentives there, and we're going to remove the geographical barriers, and then we are also going to empower you to know that you can do it right here. You can do it part-time, you can do it full-time, all hands on deck.
You can be a respiratory therapist. This is what a respiratory therapist does. Or, there are opportunities to get your public health certificate and enhance your career. So just really bringing that opportunity to them so that they know that this is something that they can do.